Guduchi Kashaya. Chinnodbhava Kashayena Sevyam Shuddham Shiraja. When it is most effective, Panchakarma Vishuddhena. When person is purified with the Panchakarma and then if it is administered, Vatarakta Prashantini, it is very effective in subsiding Vata. Another very important formulation that I have to stress in Vatarakta or in gouty arthritis or systemic lupus erythematosus, both in Utthana and Gambhira Vatarakta and in Dushtavrana and Kushtale conditions, is Rasamanitya. This is safer than Talabhasma. I use this extensively in various kinds of challenging skin diseases, including Vatarakta. Half to 1 rati is the dose, Madhu and Krita are the Anupana. Vatarakta, Sputita, Galita Kushta, Bhagandara, Nadivrana, Dushtavrana, Upadamsha, Vicharchika are important indications. Confirm that it is prepared properly, it is prepared from Shodhita Patratala only, because Pindatala can cause uterine toxicity, Stri Pushpa Haranam Tattu. Otherwise, also it is ideal to use it for 1 to 2 months, and after that, at least you have to give a break of 4 weeks if at all you have to again use it. Because arsenic is tend to cause some cumulative toxicity in prolonged administration. Otherwise, this is an absolutely safe drug. Never it causes acute toxicity in therapeutic dose. Then the last list is Rasaushadhi in Sandhigata Vata. Mahayogaraja Gugulu, well known to you. Vata Gajan Kusharasa is indicated in Vatavyati, Sandhigata Vata, Kroshtuka Shirsha. Kubja Vinoda Rasa is another very interesting formulation containing Abhaya, Haratala Bhasma, Shuddhavatsanava, Katuki, Trikatu, Bola, and Jayapala. This Kubja Vinoda is to be given in a dose of 250 milligram with Madhu and Rasnari Kashaya. It is very effective in hip arthritis like condition. Brihat Vata Chintamani, Vata Vidhamsa can also be used in Sandhigata Vata. Vatari Rasa and Rasaraja Rasa, which are indicated in Vatavyati, Amavata, also are indicated in Sandhigata Vata. There is a unique formulation mentioned in Chikitsa Pradipa, that is Vata Vidhamsa Mishranam. Vata Vidhamsa Mishranam is a combination of Vata Vidhamsana Rasa 1 part, Hingwadi Churna 4 parts, Parasika Yavani Churna 4 parts. This mixture is given in a dose of 1 to 2 masha, 750 milligram to 1.5 gram. It is to be given in Antara Bhakta dosage twice a day. So after morning meal or morning breakfast is digested, say at around 11 o'clock or so, you have to give this. Then after this medicine is digested, give the food. And again, after that food is digested, give the medicine. Like that. Give it twice a day with Ghrita and Ushnapeya or Ushnodaka alone. Now, the last part of the study is a few scientific evidences for the efficacy of Rasaushadhi in rheumatic conditions. So let me try to be a bit quick. Sorry that I have taken your time. Sorry for the technical glitches in between. Let us take a few examples. Amavatari Rasa was evaluated both clinically and also experimentally. In experimental study, it is evaluated by Abhilasha and others, where anti-inflammatory activity was studied in Fronts adjuvant-induced rheumatoid arthritis in albino rats. And in this study, paw edema, hind paw edema is recorded with the help of plethysmograph on 1st, 7th, 14th, and 21st day. And Amavata Rasa found to be equally effective to the prednisolone, and it reduced paw edema to a great extent, remarkably, when compared to the disease control group. Another study is by Sonam Phinde and others under the guidance of Dr. Galib sir and Dr. P.A. Prajapati sir. This is a very interesting clinical study. Impact of mercury on the efficacy of Amavatari Rasa in rheumatoid arthritis was studied. It is published in 2016 as a randomized double-blind clinical trial. It is an open access article. You can go through the article for more information. Study was carried out in 86 patients. Here, two Amavatari Rasa were tried. In one group, Amavatari Rasa without mercury, and in another group, Amavatari Rasa with mercury were studied. Both medicines were given 250 milligram thrice a day, 30 minutes before meal with lukewarm water for 8 weeks. Based on clinical recovery, symptomatic relief, and pathological investigations, assessment was done. At the end of the trial, the doctor was revealed that this was the drug use because it was a blinded study. Both formulation, interestingly, showed highly significant clinical result, P less than 0.001 on biological markers. But even though they showed almost equivalent result, Amavatari Rasa containing mercury appears to be influencing the cellular level of pathology, and Amavatari Rasa without mercury provided only symptomatic relief. So it can be inferred that presence of mercury is essential as it helps in taking the drug into the cellular level and it helps in breaking the pathology successfully. Another study is by Dr. Vijayendra Ji Bhatt from STM College of Ayurveda Udupi, where 40 patients of Amavata were evaluated. Here Amavatari Rasa alone and Amavatari Rasa with Valoka Sweda were studied. In one group, only Amavatari Rasa, which had 20 patients. In another group, 20 patients who received Amavatari Rasa and also Valoka Sweda as a treatment. Combined therapy was more effective, P less than 0.001. Here, group A received Amavatari Rasa 750 milligram twice a day in empty stomach for 30 days with Ushnodaka Anupana, followed by a dietary measure, and follow-up was done after 30 days. In group B, same Amavatari Rasa 750 milligram with hot water in empty stomach twice a day for 30 days, and Valoka Sweda for 3 weeks with same dietary restrictions. So combined therapy would be advisable. Another study by Deepika Singh and others on the effect of Amavatari Rasa and Chitraka Churna along with Sweda. Here, 45 clinically diagnosed cases of Amavata with rheumatoid arthritis with objective of clinical evaluation of therapeutic effect were done. Here, degree of severity of the disease was almost same in all the groups and they were effectively controlled. Group A had 13 patients where Amavatari Rasa 500 milligram BD, Chitraka Churna 3 gram BD, Valoka Sweda 10 to 15 minutes for 2 to 3 times a day for 3 months was given. In group B, 11 patients with classical Ayurvedic Amavata Chikitsa, Langhana, Svedana, Tiktakatu, Aushadhi, Deepana Drobya, Virechana, Snehapana, Basti. Entire course was given. In group C, 10 patients were given with modern drug diclofenac sodium, a non-steroidal anti-inflammatory drug. And this is a very interesting study. On the basis of observations, it was very interesting to note that effect of the trial drug, that is Amavatari Rasa and Chitrakada Churna with Svedana, and also total Ayurvedic regimen were equally effective when compared to the diclofenac sodium. But if we talk about efficacy between the trial drug, that is Amavatari Rasa, Svedana and Chitrakada Churna, and total regime was more effective in treating all signs and symptoms and additional symptoms like Agnimandya, flatulence, regurgitation, etc. However, you know that following an entire regimen may be difficult. So in such situation, we can consider using Amavatari Rasa and Chitrakada Churna with Sweda. Another study by Phinde and others was a single case study where Amavatari Rasa was studied, 250 milligram thrice a day with lukewarm water for 8 weeks. 35% clinical improvement was observed in this case. Next formulation is Rasaraja Rasa, where SK Singh and Rajoria K worked on a single case study. It was a single case report on ankylosing spondylitis, which you know highly challenging. Panchakarma was also planned here. It was a 2 months regimen. He considered the condition as Asthimajjagatavata and treated with Shalishashtika Vindasveda for a month, Ustadiyapanabasti with Anuvasana in 30 days schedule, then oral Ayurvedic drugs. Then Pratimarshanasya, that is Anukaila, was given for a month after Basti. Here, all standard Spondyloarthritic International Society scale was used. Under oral medication, as Rasaushadhi, Rasaraja Rasa was utilized with honey for 2 months. Around 125 milligram was the dose that was indicated here. Twice a day was the regimen used. It had given excellent result, and the patient was followed up after the completion of 2 months for 1 more month, and patient was almost asymptomatic here. Next example is Samira Pannagaras. A single blind clinical study was done on Amavata with rheumatoid arthritis, and it was conducted at the Central Research Institute, Kolkata. Study was carried out between May 1999 to March 2004. 157 patients were selected based on American College of Rheumatology guidelines and also as per the protocol designed by CCRS. Here, Vardhaman people Kshirapaka and Samira Pannagarasa were given for a period of 6 weeks. Samira Pannagarasa 250 milligram thrice a day with honey. Pippali Vardhamana Kshirapaka from 2nd week till end of the course. First day with 1 Pippali and increased gradually for 6 weeks. The results were assessed in terms of clinical recovery, functional recovery, recovery in ESR, and so on. Out of 157, 27 had good response, 50 fair response, 24 poor response, 4 had no response, 55 dropped out. So 102 patients completed the trial. Next is an example of Siddhamakara. Here, as I mentioned earlier, a combination of Ashwagandha Churna and Siddhamakara was studied. Here, 125 patients with joint pain were screened, out of which 86 satisfied the inclusion criteria. They were selected for the study. They were given with 5 grams of Ashwagandha Churna twice a day for 3 weeks with lukewarm water or milk. Then Siddhamakara 100 milligram with honey daily for next 4 weeks. So first 3 weeks Ashwagandha and next 4 weeks Siddhamakara. Then after that follow-up was also carried out. They followed the study very methodically. They considered primary efficacy and endpoint based on American College of Rheumatology or ACR 20 response. Secondary endpoints were ACR 50, ACR 70 responses, where 50 to 70% improvement was considered. Then change from baseline in disease activity score 28 was also considered. Safety assessment was also done, ALT, AST, ALP, then beta microglobulin, renal function tests, urine mercury level were also studied here. The study was completed in 90.7% patients, that is 78 of 86 completed the study. Patients with moderate and high disease activity, that is 57.7%, then moderate were 42.3%. They responded quite well. ESR was improved, RA factors were improved. And I'm not going for the detail of the study. Report, you can go through the study, it is available online. Conclusion is that Ayurvedic treatment as a combination of Aushadha, Ashwagandha, Churna and Siddha has potential in the management of rheumatoid arthritis. You have to go for a larger sample size and a longer duration of the study to get a better result. Here LFT, RFT remained normal, but there was an increased urinary mercurial level. Take a study. There is a study on Godanti Basma, which was a single blind clinical trial. An interesting combination of Shunti, Guggulu and Godanti was studied in 47 patients of Amavata. Combination is like this. One part of Shunti, 2 parts of Shuddha Guggulu and 1 part of Godanti. 500 milligram, 1 gram, 500 milligram. Total 2 grams thrice a day with warm water. Then all subjective, objective criteria were considered, and 1/3 of the patients showed good response and remaining 1/3 fair response. Pravala Bhasma was evaluated for its efficacy on osteoporosis in animal study. This study was a very well planned study, published in 2003 itself. It was designed to investigate the inhibitory effects of Pravala Bhasma on the progress of bone loss induced by ovariectomy and concurrent calcium deficiency. So here in 24 animals, the study was carried out. I'm not going for details of the study. SCM was followed here, scanning electron microscopy. Formulation was also standardized. The present study concludes that Pravala Bhasma is effective in the prevention of calcium and estrogen deficient bone loss, which is commonly observed in postmenopausal women. So this justifies the continuing use of this Ayurvedic preparation in all such osteoporotic conditions, wherever osteopenia, osteoporosis is observed related with the conditions like osteoarthrosis or other rheumatological conditions also. Pravala Bhasma can be a good option. And as a combined therapy, In a case of ankylosing spondylitis, a 25 years case was treated with Patrapinda Sweda, Eranda Muradivasti in Kala and Kramavasti along with oral medication. And here, as an oral medication, they have used Simmanada Gugulu, Rasna Saptaka Kashaya, Mahavata Vidvamsana Rasa. And they used a unique powder formulation containing Nagaradya Churna 1 gram, Chopachini Churna 1 gram, and Ashwagandha Churna 3 gram after meal twice a day with cow milk. And the therapy was for 16 days. So here, 16 days of Nidgundi Patrapinda Sweda, Eranda Mola Divasti, Anvasana Basti with Dashamura Taila, and then oral medication of Rasna Saptaka, Simmanada Gugulu, Mahavata Vidvamsana, and a Churna combination for 16 days. And the follow-up was done for almost 6 months. So after 16 days, they stopped Simmanada Gugulu, replaced it with the Trayodashanga Gugulu, again continued the medicine for a month. Then for past 2 months, they say that all medicines were stopped and the patient was asked to refrain from cold and sour substances, and patient is absolutely asymptomatic. In another condition, Shiva Gugulu and Simmanada Gugulu were comparatively tried in Amavata. 6 gram of Shiva Gugulu per day in divided dose, and same 6 gram of Simmanada Gugulu per day in divided dose for 8 weeks. Out of these formulations, Simmanada Gugulu was found to be more effective. In another study, Simmanada Gugulu and local application of Dustura Adilepa was done. This was in 60 patients of Amavata at Banaras Hindu University, where highly efficacious result could be seen. There is another single case study of rheumatic fever, a successful case report. This rheumatic fever case associated with dyspnea and body pain was treated with the Rasna Saptaka Kashaya, Rasa Sinduram, Yogaraja Gugulu as main medicament. Along with that, Churanakili, Churunavasti, and also Lavanakili was done. This is a single case study reported. Balarishta 25 ml twice a day after food. Kaishora Gugulu 1 tablet twice a day after food. Agastya Rasayanam, Dali Sabatradi Churnam, Rasna Saptakam, Yogaraja Gugulu, and as a mineral drug, Rasa Sinduram was used in this study. And this is a single case report which is published. So with this, let me conclude today's presentation. Conventional Ayurvedic treatment is always aimed at reducing inflammation and associated symptoms that may include pain, swelling, restricted movement, that is the stiffness, and also at preserving joint function, rather than using only the drugs that suppress immune system. Rasaushadhi certainly have an edge in managing various types of joint disorders. Swarnakalpa have disease modifying and immunomodulatory effect in rheumatoid arthritic patients. However, a complete approach of treatment including relevant panchakarma and dietary guidelines will give you the best results. So combining Rasaushati with other therapeutic protocol would be most advisable, but many a times in a clinical practice, it may not be possible to follow the Panchakarma procedures, but at least you can ask the patient to follow proper Patyapatya and use Rasaushati for the best possible therapeutic results. With this, let me conclude. Thank you very much for your patient listening. Thank you.
Can we ask questions, ask the participants to ask questions?
Yeah.
Participants, you can ask the questions. So there's one question already in the chat box. Difference between Rasaraja use and Yogendra Rasa in relation to therapeutic indication.
Thank you for the question. Both of these formulations are available. In the market. Primarily, what we observe in clinical practice is that both of these formulations, including Rasaraja Rasa and also Yogendra Rasa, are used in Vata Vyadhi. However, both are having unique indications. Sorry, unique indication in managing rheumatological conditions also. So if you want to specifically look into these formulations, Rasaraja Rasa is a formulation which contains Swarna Bhasma. It is a Swarna Kalpa. Being a Swarna Kalpa, it has got an advantage of Rasayana effect. It is found to be more useful in Jirana conditions. In Jirana Amavata, and also in Jirana Sandhigata Vata like conditions. In rheumatoid arthritis, even in Western system, of medicine, they make use of golden preparations as a disease modifying agents. If you are talking in terms of rheumatological situations, this formulation, that is Rasarajarasa, is found to be more efficacious in managing Jirna. Nirama Amavata and Sandhigata Vata like conditions. Apart from this, apart from Amavata or Sandhigata Vata like conditions, this formulation is also indicated in multiple other conditions. Say, for example, it is useful in Pakshaghat. It is useful in Ardhi. It is useful in Hanustambha. It is also effective in Apatantraka, Apatana Kalaya.